I'm Kat Navarro Lee with the B Foundation for Brain Aneurysm Prevention, and I'm here with brain aneurysm survivor Megan Sanchez. Thank you so much for being with us, Megan.
Oh, thank you. It's a pleasure to be here.
I thought it would be a great idea for September being Brain Aneurysm Awareness Month, and it's also Latino Heritage Month. So I figured two different things where we'll be celebrating you and also helping bring awareness about this condition. So again, you are an inspiration, and thank you for sharing your story with us. Just to let other people know, I met Megan. She's been such a big part of my story because when I had when I was preparing for treatment for my own unruptured brain aneurysm, I was doing a lot of research and didn't know which direction to take. And an article about Megan came up on the internet, and it was talking about Megan's surgery with Barrow. And so I also turned out that Megan is local. We're both in Los Angeles and we had some other things in common. And so I reached out and I think I either emailed or DM'd you or something like that. And Megan was so sweet enough to respond. And having that conversation and her telling me about her story where your aneurysm, it was, a very big aneurysm and a difficult surgery and complicated. And so it really gave me inspiration and courage to be able to move forward with also getting treatment for mine. So thank you again. And
Oh, of
yeah,
course.
I'd love for you just to share a little bit about your story with us.
Okay, sure. I guess I could start at the beginning. I had migraines for about 3 years, and kept progressively getting worse, and they would kind of come around the afternoon. They didn't feel like a normal migraine because I wasn't light sensitive or sound sensitive. But then one day when I was at work and was actually on the floor helping somebody, I worked at a makeup store. I almost fainted and I had to leave the floor. And then I went straight home and got my blood pressure checked at a local grocery store because they have those cuffs that you can check your blood pressure with, and my blood pressure was really low. So then I called my dad. My dad is a physician, and he said that, well, maybe we should get you in to see a neurologist. And he did like a basic check on me, and he thought that I had cluster migraines. But then my dad suggested that I get an MRI. So I went to what was it? The Providence St. Joseph Hospital, which is right down the street from me, to get my first MRI. And the radiologist there said that there was definitely something in my brain, but it wasn't super clear. I think we did a CT scan from there, and then they recommended that I go see a brain specialist at the neurology department at Keck Hospital at USC. So I made an appointment to go there, and the doctor looked at my initial like MRI and my CT scans and said that it wasn't in the normal place, which was true. Like my aneurysm was well, what they thought it was at first was mass vascular malformation because I have another syndrome called KT, Klippel-Trenaunay-Weber syndrome, and that kind of causes vascular malformation, venous malformations, and so they just were thinking it was like maybe a vascular malformation that was there from when I was young. And again, like the doctor took a look at the CT scan and said, I think that's too big and it's not in the right place because most aneurysms are on the surface of the brain. Mine was deep in my like near my audio cortex and my motion cortex. So he said like it's not like in a normal place and it looks too big to be an aneurysm. I just really think this is a vascular malformation. He said, but in order to actually diagnose it, I think we're going to need to do a CTA scan, which is like a CT with contrast. So he said, oh, I can schedule in 2 weeks. Again, no, you don't have anything to worry about. Um, After that point, like I told him, I said, well, I don't live close to USC. I don't live close to this hospital. Maybe I can get in for a CTA scan now, like today. And he said, well, you know what? Actually, I don't see a reason why not. And so he called downstairs, and like within 15 minutes, they had got me in for the scan. And I'm really glad that at that point that I kind of kind of push the issue to like, because I really wanted to know. Um, he told me after the scan, he's like, well, the radiology department is going to take a look at it. We'll probably call you in about 2 weeks, and then we'll probably see you again for another follow-up appointment if anything is concerning. And then I left and went home, and I didn't even get halfway home before I got a call from that same doctor at Keck that it was an aneurysm and it was extremely unusual, and that I needed to come back like the next day because they had never seen anything like it. It had two arteries that were coming off of it. So it was very strange. And again, the location was strange. But he said it's definitely an aneurysm. So after that point, like they took me back into the hospital, they discussed it, and they said, well, we need to give you a series of angiograms. So I had about three. And the second one was actually they had me semi-awake for the second one. They had to ask me questions and they had to clamp off the arteries to see if the oxygen in my brain would be cut off if they clamped off the arteries. They had to ask me a series of questions and see if I was still okay if they did anything to the arteries. I ended up passing that exam. So they said it was possible that it could be operated on. And then they called us in for another exam like a couple weeks later. So they did their final angio, and then a couple days later, they said that they didn't think that it was operable, that my aneurysm was about 11 to 12 millimeters long, so it was extremely big. But they were worried that, like, because it was so deep in my brain and a hard location to get to, that they might rupture it just trying to operate on it. And then the arteries coming off it were extremely dangerous. Um, they basically said that they would want to wait and keep an eye on it and see if it changed. Because again, they didn't know if it had been there from when I was born or not, if it was even going to change in size. Um, but like I knew at that point like that it wasn't something I wanted to wait to see because it was so large that like I felt like if we waited, like I was kind of like w walking around like hoping I didn't die. And like I also like was driving at that time and I was also like scared that if something happened or it ruptured that, I would hurt somebody else or it would happen at work and like nobody could get to me fast enough because they said like in the first 15 to 20 minutes, if somebody wasn't helping me because it was so hard to get to, that most likely I would have a 10% chance of living. And I would also like be severely impaired, like either speech or my mobility on one side. So I was like, I didn't have a good feeling after that meeting where they said they couldn't really operate on me. Thankfully, both of my parents are in the medical industry, and they said that we're going to get a few other opinions, and they sent it out to a bunch of hospitals that have good neurology departments. Um, and we ended up going with Barrow Neurological Institute in Phoenix. We saw Dr. Michael Lawton. He's like I think he's like number two in the world for like aneurysms. The guy that trained him like wrote the book on like aneurysms and how to treat them. So like after kind of considering everybody else, we kind of went with him because he had like the most comprehensive plan to like help me. Um, so we flew out to Phoenix and I was in surgery in like the next couple of days, so it happened very quickly. Like he said he didn't want to wait because it was a time of the essence kind of thing. Like they didn't want it to get
Right.
any worse. Um and then after that, like they put me into surgery. I had to have open brain surgery. It couldn't be clipped like a normal aneurysm. It couldn't be coiled or clipped like a normal. Usually they go through your artery in your groin. But the femoral artery, and that wasn't an option for me. It gets especially again where it was, and then like the arteries coming off would have to be addressed, and they couldn't do that without actually opening me up. So I went
Hmm.
to surgery. They told my parents it was going to be about 9 hours. It ended up being
Oh,
about 12 hours. So it was a long, long, long surgery. He had many fellow surgeons there helping, taking turns. It took about 6 hours for them to even reach the location because again, my brain is like it has a lot of like vascular malformations, and it was so difficult to even get through that. So they didn't cause any damage to my brain. So it took a long time to even get to it, and then they did something that's called like a STAMCA. So it's called superficial temporal artery to middle cerebral artery surgery. So they harvested a temporal artery from the side of my head, um, and then they used it as a bypass in my brain. So like it wouldn't cut off the access to the arteries and while officially taking away like the artery, the blood's access to the actual aneurysm. So it would kind of cut that off, but it would also allow the blood to flow through those arteries that were connected to it. So it was kind of it was a lot. It was a lot of surgery and like the recovery process was a lot, but I was very lucky to even be accepted to do that surgery because not every patient that he looks at, he accepts. So it was a long ordeal, but I'm very lucky that I'm here because again, like
right,
it was so rare. They had never dealt with it. Like even this doctor hadn't seen it. He had dealt with a lot of rare ones, but not anything like mine. Um, so it was still like a chance. It was still a chance that something could go wrong. Um, but like a couple days afterwards, I was sitting up and like actually even the day of the surgery, I was sitting up and like talking to my parents. So like he was pretty surprised that I was even up. He came by and did his rounds and he was surprised that I was even up. He like kind of looked at me like,
right.
"What are you doing up?" But yeah, I was very lucky because afterwards I didn't seem to
Mhm.
have any talking problems. I didn't seem to have any like palsy on one side. So I was very lucky.
Wow.
But
Yes,
that's
lucky.
about
And
it.
there's so much that went into that because for USC, which is, a good hospital to say that they
Hmm.
couldn't operate on you, there's many people that may have just been okay with that and say, okay, well, their professional opinion, I should just monitor. But your parents, it's so nice that they're able to kind of have that other perspective of like, we need to get second opinions. We need to figure out what else is
Yeah.
possible and to do that research, which is so important that not everybody would think of that or even has like the resources to know what other places are out there.
Exactly. Yeah. I mean, the other one was like the one we considered was in the Mayo Clinic because again, they're always like the forefront of medicine. But they even said like if Barrow is so close to you, like that would be our preference. We could perform the surgery, but it's a lot further away. So like they said again, that hospital is excellent. So again, I was very lucky. And then again, like you said, I would have probably just accepted what USC said and like if my parents hadn't been there, if I had been on my own, I probably would have been like, well, they know it's best. Like if they think they're going to stroke me out by actually trying to operate on it, then I would have kind of just given in. And who knows like what would have happened if I had waited any longer. Because again, like when we told Dr. Lawton, he was like, no, we want to do surgery right away. So like for him,
Right.
it was like an urgent need to get me into surgery. So like it kind of was in contrast to them wanting to wait was, totally different.
Right. Right. And the outcome, like you're doing great now. What were some of the side effects that you experienced after your surgery?
Like I was telling you, like when I first woke up,
Yeah.
like almost like a computer rebooting. It was like I was like thinking at like a really fast pace. I was talking a lot too, and it might have been the medicines that they had me on, but like I was like going really fast, and thinking really fast at
Right.
first. And actually, when I first woke up, the most pain I was in is because like they had kept me on my side for like the whole 12 hours, and so my side was extremely in pain. Like I had like a lot of muscle cramps on one side, and then the catheter that they had in. So I didn't even notice the pain afterwards. Um, I would say like when I first got up, and then like after the first night, I was texting fine. I was like speaking fine. But then like a few days after that, like I remember I was in the hospital and my uncle was trying to text me, and it took me almost a half an hour to text him back because like I had just lost the ability to like form words, like type out. Like it kept feeling like I couldn't remember the correct word or how to say something. So that kind of freaked me out at first. But they did say that that could happen. And then like my speech was like after a while, like after a few days too, like was definitely, kind of stilted. Like I could get words out, but it'd take me a long time. Like I would, like I was at home and I was at the hospital, and then we went to the hotel afterwards, and then they kept saying, well, your speech might be a little bit messed up, but like even a few days after I got into the hotel and like was discharged from the hospital, my speech was a little bit slow. So, I mean, I was just, I, again, like they said to expect it, but when you're going through it, it's kind of a little bit scary. But
Hmm.
other than that, like, I mean, I was just tired. I was really tired.
Right.
My body felt achy, and it was just taking things slow. Like I was lucky to have my mom come and live with me where I live in Los Angeles. And so I would say like the whole recovery was about 3 months, and then I actually went back to work. And this was right, like my surgery was in 2019, and it was like right in the middle of COVID when I went back to work. So luckily we didn't have to deal with any people inside the store, but I was still working during that time. But I feel like my recovery was even fast for what they thought it was going to be, because they were
Right.
surprised to hear that I went back to work so quickly. So, I mean, again, it still wasn't like I still wasn't 100% like when I went back to work, but I definitely felt like close to normal anyway. Um, so I mean, I was very lucky that that was the only issue that I had, was that I was just feeling a little bit tired at that point.
Yes, you've made a very impressive recovery. I
Mhm.
mean, talking about the kind of surgery that you had is very complex. And so
Yeah.
we're so glad that you were able to find a place that really specializes that in that, and you were able to kind of to get the help that you needed for a very complex condition.
Oh yeah, definitely. Yeah, exactly. Like it was one of those things that even the first doctors, like they had teleconference to other doctors like before they gave me that diagnosis of like probably not being able to work on me. They like teleconferenced with like I think 7 other doctors, and they all said the same thing, that they had never seen anything like it, and that it would probably be not a good thing to work on it. But again,
Right.
I'm glad that I got that second opinion and that I'm still here today, you know.
Right. And it really speaks to the importance of prevention because
Yeah.
had you just dismiss, the initial migraine as just being something else and not being something more serious, and that could have led you down a totally different path. So we
Oh,
are
yeah,
so
definitely.
grateful that you're here and healthy and well.
Hmm. Yes, yeah, exactly. Yeah. I mean, a lot of times when they're with aneurysms, there's no like, precursor, there's no like symptoms to notice that you even have it. A lot of the times, like their headaches are symptoms, but again, like you said, like it wasn't a normal path or route to take to get actually getting me the MRI like at that point. But I think I had had my migraines for so long that I did feel like there was
Mhm.
something wrong. And like also like I credit my dad with like kind of telling that doctor that I think she should get checked out for an MRI, because
Right.
any treatment that they were giving me, they did start me off with like a certain medicine. It wasn't working. It wasn't doing anything. And I was
Hmm.
also on so much ibuprofen to deal with those migraines that like I knew that I shouldn't be taking that anymore because I was doing damage to myself. Like I was hurting my stomach and everything else. And so I just knew it wasn't like a great thing that I was taking like 800 milligrams of ibuprofen every day to deal with migraines because Tylenol wasn't working, anything else wasn't working. So
Right. So I know that you've had follow-ups. Can you tell me about the follow-ups that you have to do just to monitor?
yeah, like so I just had my 6 year follow-up. They what they do is they just do like another angiogram to check to see if everything's going well, like if my bypass is still functioning, like the flow is going in the right direction, all of that kind of thing. And at my at the checkup appointment, they actually said that nothing was wrong, that everything looked good. Yeah, so I was really happy. I was
Hmm.
kind of scared. I was kind of scared, obviously, that they were gonna find another one because a lot of the times when you have an aneurysm, there's more than likely another one. So
Right.
I was just kind of paranoid that they were gonna find something else or something wrong with that one. So yeah, again, I was very lucky. Nothing seemed out of the ordinary. No blood was going into the aneurysm anymore. So I was, yeah, again, I was very lucky that nothing else was coming up. Yeah.
Yeah, I know that that's a fear that a lot of other aneurysm survivors have of you're glad that you have that checkup to really keep on top of things, but at the same time,
Yeah.
and there's also some anxiety that hoping that they don't find anything else. So,
Oh, yeah, exactly. Yeah. I was, again, like I was blessed to be able to have like the access to like get another scan and, I didn't have to go back to Phoenix this time. I just did it locally.
mhm.
But they were talking to my doctor the whole time and they sent my scans to the doctor and he checked it again and he again said that there was nothing wrong. So again, I was really lucky.
I think that just shows the importance of collaboration in the medical field, right? That these
Hmm.
doctors with different expertises are able to just talk to each other and like no ego, but being able to really collaborate and find the best solution for their patients. So
Yeah.
I think your
Yeah.
story really promotes and encourages that.
Yeah. Well, thank you. Yeah. I mean, it felt surreal at the time. It didn't feel like it was happening to me. Kind of like if I think I had time to think about it, I probably would have gotten freaked out. But for whatever reason, when I was going through it, like I didn't worry about it too much. So it was just I was just lucky that like I felt I had the support around me and I also like
Right.
kind of knew what was happening. It was like they were very good about explaining like the whole surgery and what I was going to get into and all of that. So I mean, again, like it didn't feel like it was happening to me. So in a way, it was good that it happened quickly and that I didn't have to think about it too much to going into it. So I was, in that sense, like I was kind of lucky that, I didn't have time to freak out about it because I would have otherwise.
Right. Well, thank you so much for sharing your story with us. Is there anything else that you want to say to maybe encourage people during this Brain Aneurysm Awareness Month?
Um, Maybe just to like trust your gut. And if you feel like something else is wrong, if you feel like you're getting headaches out of nowhere, or if you feel like you have any kind of symptoms, just getting checked is like important. Obviously, if it's head related, like again, like I don't know if I would have known anything about it if I hadn't gotten like that MRI scan. So maybe sometimes just like being extra careful or extra cautious when you're feeling weird
Hmm.
or like you feel like you're faint or that kind of thing. Because again, like a lot of the times like aneurysms burst and they don't have a chance to like save you because it happens so quickly and so I'm just thankful every day that I went through
Right.
the process of trying to get checked out fully. And I think if you are dealing with an aneurysm or if an aneurysm has burst, I think you're a warrior. And like, because I never had that experience of having it burst. So like, I mean, I just can't even imagine what some people have had to go through. So I just think that those people are really brave. And if you're dealing with an aneurysm and you're thinking about getting it operated on, if it's a low chance of anything happening, I would say look into actually getting it fixed because it's not something you want to like feel like could happen at any moment. like because I
Right.
just feel like it's something that it's better addressed than not, I think.
Right. The importance of prevention because
Yeah,
we're
prevention.
doing
Yeah,
so well
definitely.
now.
Yeah, definitely.
Yeah.
Yeah.
Thank you so much, Megan. We really appreciate that. And
Oh,
we
no
know that your
problem.
story is going to help bring awareness and inspire and encourage others. So thank you again.
Oh, no problem. Thank you. Thank you for having me.